So I grew up in Australia and my family moved over about 30 years ago. My parents were both chiropractors in Australia, had a busy chiropractic clinic. So as a kid, I was often hanging around in the clinic and seeing them treat patients. So I always had a desire to kind of follow in their footsteps and do something in the pain arena. But I was interested in doing something a little more for those folks that didn't respond to conservative care. There was a segment that just didn't seem to get better. About 80% of people will improve with conservative care, but what do we do for that 20% that don't get better? So we moved to the States, and then after my medical school, I did my residency at St. Louis University, and it was during my anesthesia residency that I got a chance to rotate in the pain clinic. And that was a perfect fit for me. So after a couple of days in the pain clinic, I knew I'd found my home. So subsequently finished my anesthesia training, and then I was fortunate enough to do a pain management fellowship at Harvard in Boston at the Beth Israel Deaconess Medical Center. Yeah, I'm an avid golfer. I don't know that I'm that good, but I love to get out, and it's great to be outside with friends. My family, my children are up in Salt Lake, so I enjoy getting up there and spending time with them and enjoying the outdoors, boating, tennis. Mostly enjoying the outdoors here in southern Utah. When I arrived in Utah about 15 years ago, we were having quite a problem with the opioid epidemic, and I think that was one of the things that led myself and my two partners, John and Rick O'Bray, to form Southwest Spine and Pain to try and address that problem and bring some innovative care to the region. And through that success, we've been able to grow throughout the state of Utah, and I think recruit a lot of qualified physicians and really bring state-of-the-art care that you'd be happy to get anywhere in the country. We see a lot of success with radiofrequency ablation. We have a lot of elderly patients with a lot of arthritis in the small joints of the back, and through some simple testing, we can isolate which joints they are, and with a small probe through the skin, we're able to cauterize those nerves and provide pretty significant relief for approximately a year. The procedure takes maybe 15 minutes, and it's able to be repeated on a yearly basis. Something that's new and exciting to the field is a new procedure called Intracept, which the studies have just come out and they're very favorable, and they're for patients that have low back pain with something we call modic changes, which is where there's a little bit of degeneration at the disc and the end plate, where now we can put in a simple probe, cauterize that bundle of nerves, and provide a fairly significant amount of pain. Historically, those were patients that would generally go on and get a fusion with a big open surgery, plates and screws in their spine. So a lot of our patients are quite receptive to the minimally invasive procedure that we're able to offer now. I would say you don't have to live with that amount of pain. There is hope. There's a lot of things that can be done. Come in and we'll evaluate you. We'll guide you through what we think is the most conservative course of action, and then if we have to escalate up the chain to some of the more invasive and innovative procedures, we can do that. But we're always looking at what's the least invasive, the most conservative route to get you as feeling as good as you can.